Hi friends, this video is going to be on Omezol 40 mg. Omezol has 40 milligrams of Omeprazole in it. It's made by Bosch Pharma. The box has 14 capsules and the price for the box is 309 rupees. Omeprazole is used alone or with other medications to treat the symptoms of gastroesophageal reflux disease, a condition in which backward flow of acid from the stomach causes heartburn and possible injury of the esophagus, the tube between the throat and the stomach, in adults and children 1 year of age and older. Omeprazole is used to treat damage from GERD in adults and children 1 month of age and older. Omeprazole is used to allow the esophagus to heal and prevent further damage to the esophagus in adults and children 1 year of age and older with GERD. Omeprazole is also used to treat conditions in which the stomach produces too much acid, such as Zollinger-Ellison syndrome in adults. Meprosol is also used to treat ulcers, sores in the lining of the stomach and intestines, and it is also used with other medications to treat and prevent the return of ulcers caused by a certain type of bacteria, H. pylori, in adults. Meprosol is used to treat frequent heartburn that occurs at least 2 or more days a week in adults. Meprosol is in a class of medication called proton pump inhibitors. It works by decreasing the amount of acid made in the stomach. Omeprazole comes as a delayed release capsule and packets of delayed release granules for suspension to be taken by mouth or given through a feeding tube. Omeprazole comes as a delayed release tablet to be taken by mouth. Omeprazole should be taken at least 1 hour before a meal. Omeprazole is usually taken once a day before a meal, but may be taken twice a day when used with other medications to eliminate H. pylori, or up to 3 times a day before meals when used to treat conditions in which the stomach produces too much acid. The delayed release tablets are usually taken once a day in the morning, at least 1 hour before eating, for 14 days in a row. If needed, additional 14-day treatment may be repeated not more than once every 4 months. To help you remember to take Omeprazole, take it around the same time every day. Follow the directions on your prescription label carefully and ask your doctor or pharmacist to explain any part you do not understand. Take Omeprazole exactly as directed. Do not take more or less of it, or take it more often than prescribed by your doctor. Do not take Omeprazole for immediate relief of heartburn symptoms. It may take 1 to 4 days for you to feel the full benefit of the medication. Call your doctor if your symptoms get worse or do not improve after 14 days, or if your symptoms return sooner than 4 months after you finish your treatment. Do not take Omeprazole for longer than 14 days, or treat yourself with Omeprazole more often than once every 4 months without talking to your doctor. Continue to take prescription Omeprazole even if you feel well. Do not stop taking Omeprazole without talking to your doctor. If your condition does not improve or gets worse, call your doctor. Take the missed dose as soon as you remember it. However, if it is almost time for the next dose, skip the missed dose and continue your regular dosing schedule. Do not take a double dose to make up for a missed one. Omeprazole may cause side effects such as constipation, gas, nausea, diarrhea, vomiting, headache, etc. Some side effects can be serious. If you experience any of these following symptoms, call your doctor immediately, such as rash, hives, itching, swelling of the face, difficulty breathing, hoarseness, excessive tiredness, jitteriness, seizures, etc. There can be other side effects of Omeprazole. Call your doctor if you have any unusual problems while taking this medication. People who take proton pump inhibitors such as Omeprazole may be more likely to fracture their wrists, hips, or spine than people who do not take one of these medications. People who take proton pump inhibitors may also develop fundic gland polyps, a type of growth on the stomach lining. These risks are highest in people who take high doses of one of these medications or take them for 1 year or longer. Talk to your doctor about the risk of taking Omeprazole. I hope you liked the video. Please like and share our channel, subscribe to our channel. Thank you.